Hello, I'm Dr. David Novick, and I've been practicing here with digestive specialists for about 22 years. And although I do all areas of gastroenterology, I have a special interest in diseases of the liver. Let's talk about the most common liver disease that we see these days, and that's hepatitis C. Hepatitis C affects about 3.2 million Americans. It causes about 15,000 deaths per year, either from cirrhosis or liver cancer. And what's very interesting is a large number of people don't know that they have it. So they're walking around with it, they have no symptoms, they're not aware of it. Of those exposed to hepatitis C, about 60 to 80% will develop a chronic infection, which means a long-lasting infection that doesn't go away. And hepatitis C essentially never resolves once it reaches the chronic phase, unless it's treated effectively with medications. And the reason that it doesn't resolve is that it actually mutates within the body, so that instead of having one virus, what you actually have is a collection of very similar viruses, but they're different enough so that an antibody to one will not get rid of an antibody to others. So the infection persists, lasts for years or decades. So how do you get hepatitis C? The most common way is from intravenous drug use. There was a big epidemic of intravenous drug use in the 1970s and 1980s. And this led to a lot of cases of hepatitis C. There were about 200,000 new cases per year during that time. Now, by the end of the 1980s, there was a much greater awareness of the dangers of injection drug use. A lot of publicity all over the place about the risks and dangers of IV drug use, and people started moving away from it, and the numbers of hepatitis C cases actually have decreased significantly. So compared to the 200,000 in the 70s and 80s, there are about 17,000 new cases per year. Testing for hepatitis C is basically with blood tests. We measure liver enzymes. Well, hepatitis C is diagnosed with an antibody test, and once that's positive, we check the actual number of virus particles in the blood. That's called the viral load, and that is very useful in that a lower viral load may respond better to treatment. We also do an ultrasound to look for any evidence of cancer of the liver, which is associated with hepatitis C, usually in the presence of cirrhosis as well. Sometimes we do a liver biopsy, which involves removing a small piece of tissue with a special needle. This is done at the hospital, and the ultrasound is used to guide the needle to make sure it goes into the liver and not anywhere else. And that test has a very slight risk and some discomfort for some people, but overall well tolerated and extremely useful. I should mention also that hepatitis C is the most common indication for liver transplantation in this country. And because there's so many people with hepatitis C, it's made it very difficult for anybody to get a liver transplant. The demand greatly exceeds the supply. So if we could really treat more people with hepatitis C and eradicate the infection at earlier stages, we can free up livers for people with other conditions who may really need it. Treatment has been becoming more and more effective, and in 2014 it's going to be extremely effective because two new drugs have come out. One in particular, called sofosbuvir, was just approved by the FDA, and it's going to revolutionize the treatment of hepatitis C. The new treatment regimen is effective in patients with cirrhosis, patients with HIV infection. It has relatively few drug interactions, although that is something that has to be considered. And there's less laboratory monitoring during the treatment than with the past. The most important piece of advice that I give to patients with hepatitis C is not to drink alcohol. There are many studies that have shown that hepatitis C and alcohol are a very dangerous combination, that it's basically 1 + 1 = 3. Each one aggravates the other, and it's extremely important to abstain from even small amounts of alcohol with this condition. We at Digestive Specialists are very interested in treating all liver diseases, including hepatitis C, alcohol-related problems, fatty liver, and any other problem. Call us at 534-7330 and make an appointment. We look forward to seeing you.